Sure. Hi, everyone. My name is Vijay. As Walter mentioned, I'm a research associate here at HSPN. So I'm just going to spend a few minutes talking about, how we've reported on some of these indicators and go into a little bit of detail on how to interpret some of the graphs that you have been sent in your PowerPoint presentations. So each of the 53 OHTs, they have received a PowerPoint presentation which presents their OHT results. And within that presentation, we've actually included a little bit of sample interpretations that we hope you find very useful when you're looking at your data. And each OHT also would have gotten 3 different Excel spreadsheets, which contain their own OHT's raw data for 28 different indicators, and we've done it stratified by 3 meaningful subgroups. So we've done it by Chi-High population grouping, by BC matrix system, and by primary care model. So I'm just going to spend a little bit of time walking you through a few components of the PowerPoint presentation that each OHT received. So there are 2 sections for these reports. The part 1, the first section, provides your OHT's ranking, and it's being compared to all other 52 OHTs on 10 overall improvement indicators, as well as 5 improvement indicators for 3 common target populations. So we focused on mental health, addiction population, the frail and older adults population, as well as end of life population. And as Walter mentioned before, this is not available for the provincial report because, again, it's for OHTs that are being ranked against each other. And the second section of the report that Walter will focus on provides your OHT results for 12 indicators stratified by 4 different useful subgroups. So we've done these 12 indicators by material deprivation, primary care model, Chi-High population health grouper, as well as BC health system matrix. And the 12 indicators that HSPN chose to visually represent was just identified as being the most important to OHTs at this time. So I'm just going to focus on the first part of the PowerPoint presentations that we've gotten. So these are just a list of improvement indicators that we looked at when we were ranking all of the OHTs against each other. And you can see there's 4 major headings or subgroups. The first one is we have 10 overall total population improvement indicators. And we look at things like premature mortality, ALC days, ACSC hospitalizations. And then moving on to mental health and addictions care indicators, we look at things like the number of patients that had frequent, so more than 4 ED visits for MHA, as well as repeat ED visits for mental health as well. And then for older and frail adults, we again have 5 improvement indicators. We look at falls, that ED visits that were, related to falls, as well as caregiver distress. And lastly, for palliative and end of life care, we look at things like deaths in hospital and ED visits in the last 30 days of life. So we did use spider diagrams to help rank each OHTs across all these various indicators for both 2021, 2022, and 2022, 2023. So you'll see a sample of these spider diagrams in the upcoming slides, but typically the light gray lines, they kind of look like a spider web. They highlight the actual ranks, where closest to the center indicates the best rank among all OHTs. And then data points that are furthest from the center, they indicate the worst rank in comparison to the other OHTs. Each indicator is oriented so that the best performance is always closest to the center, regardless of whether the best is represented by like a very high absolute score or a very low absolute score. So we're always trying to get to our point to the closest to the center. And one thing I really did want to highlight is that spider diagrams measure performance relative to other OHTs for each year. So your OHT could end up in a situation, for instance, where they could have performed better in 2022, 2023 compared to the previous year. But if on average, all of the other OHTs also performed better in that specific indicator, your point on your spider diagram could actually be further away from the center. And it looks like you've done, a little bit worse in the next year when that's just the relative score, whereas your absolute score could have been higher. So in general, when it comes to spider diagram interpretations, we're trying to be small, we're trying to be close to the center, and on target is better. So we're just going to go through a few examples of spider diagrams that actually represent, actual OHT spider diagrams. So for here, we have a spider diagram that's looking at this particular OHT's performance for total population indicators. And as mentioned, we have that light gray web that indicates the ranks. The light green points represent the OHT's performance for 2021 and 2022. And the darker green represents the OHT's performance for 2022 and 2023. So you can see here, this particular OHT seems to have some issues with ACSC hospitalization, a few issues for avoidable ED visits as well, and slightly less concerning issues for continuity of care. Particularly if you look at ACSC hospitalization, this OHTs have ranked lower compared to the other OHTs in 2022, 2023, compared to the previous year. So you can kind of see the dark green is a little bit further out compared to the light green. Whereas this OHT seemed to have ranked very similar for avoidable ED visits. And then for continuity of care, you can see this OHT has ranked slightly higher than the other OHTs compared to the previous year. So overall, when this OHT is kind of looking at this spider diagram, they should absolutely look at other population-specific reports for additional ideas, but definitely something that they could focus on is ACSC hospitalization. So this is a sample spider diagram for our mental health indicators. As you see, we have 5 of them. And starting off with the top center, the first contact in ED for MHA, this OHT seems to be doing fairly okay, and the ranking is quite consistent for both years without really much change. Alternatively, when you look at the frequent ED visits and repeat ED visits, there's a little bit of a flag that this OHT ranks fairly lower. As the point is quite far from the center. And another thing to note is they've ranked lower compared to the other OHTs in 2022, 2023 compared to the previous year. Moving on to how the spider diagrams look for feral and older adults. Again, we have 5 different indicators for this. And the one I'm going to focus on for this specific OHT is the fall-related ED visits. You could see that this OHT performed better than most OHTs for this fall-related ED visits, and they've been ranking quite high consistently for both years as well, as the point is very, very, very close to the center. And this is just another example of another spider diagram for end-of-life indicators. And I just wanted to end off by saying, the spider diagrams really look very different, and these are just different examples of how much they can vary from OHT to OHT. But if you want to take a look overall as how an OHT is doing, you want to ideally aim for a very small web. So if we're going to take a look at this, for example, if you want to look at the first diagram, the one on your top left, you could see it's quite large. They rank last for some indicators such as virtual visits. Alternatively, as an OHT, what you ideally want to aim for is kind of something like the middle bottom diagram where the points, yeah, we are jealous of the middle ones. The bottom diagram where the points are very close to the center. The actual diagram is quite small and it's on target. This is just a reflection of that, they're ranking consistently high for a lot of these indicators. And that was just a brief introduction into the spider diagrams as well as how to interpret them.